Good morning. Thank you for joining us today to take part in this webinar. Many doctors, physical therapists, midwives, and nurses from all over the world have signed up to participate in this event. Welcome. I can see on the chat that you are arriving for the webinar. We are waiting for all of you. And in the meantime, please let me know if you can hear and see everything. My name is Ursula Herrmann, and I'm here with Dr. Burkhard Abenstein and Gabriel Herrmann, Chief Technology Officer of PelviFly. Thank you, my fellow speakers, for agreeing to share your expertise with us today. Together, we will do our best to make this session informative and enjoyable. Wow, there are almost 200 specialists on today's webinar. Welcome. Let me introduce myself. My name is Ursula Herrmann, and I'm the researcher. I've been fascinated by women's health, in particular pelvic floor disorders, for the past 10 years. I'm the founder and CEO of PelviFly. And I would like to introduce Dr. Burkhard Abenstein. Dr. Abenstein is one of the best gynecologists who specialized in the treatment of urinary incontinence. Today, we are going to tell you more about the unique telerehabilitation system for pelvic floor muscles training from the perspective of gynecologists and physiotherapists, and also speak about what we are learning in our 3 years of telecare experience. In the final session, Gabriel, the Chief Technology Officer of PelviFly, will present the demo of the PelviFly application and portal and the most important features. Important question, where did the telerehabilitation idea come from? In the course of my work, I observed that many women, after leaving the office, don't conscientiously and correctly implement the plan of exercise at home assigned by its physiotherapist. This had an impact on the results of the therapy. Therefore, it was very important for me to support the patients in training the pelvic floor muscles at home. So I wanted to observe the muscles parameters remotely during the exercises between the control visits in the office. This is my first goal. And 5 years ago, when I was doing my PhD studies, I started working with engineers and designers from Stanford University in the United States and started a pilot study to develop implements of a telemedicine system based on an application, a vaginal device probe, a telecare portal, and the pelvic coach procedures to supervised exercises. Another benefits of all the research conducted was that it provided specialists with data from the course of urogynecological rehabilitation at home, on the basis on which they could make decision of further procedures and estimate which of the parameters improved with regular exercise. Before studying telerehabilitation system, I focused in my research on identifying barriers to health-seeking behaviors among women with urinary incontinence. According to my published medical research, it takes on average 7 years from the moment the first symptoms appear to the start of therapy. This shows an inadequacy of knowledge and preventative. The majority, 89% of women surveyed, alleviate the symptoms of urinary incontinence without the help of a doctor, sometimes using methods detrimental to the health. Pelvic floor exercise are the most basic form of rehabilitation recommended by European Association of Urology. It's crucial to give the patient the right diagnosis, to find the cause of the urinary incontinence problem, and to initiate treatment. Effective therapy requires close collaboration between the patient and doctors and physiotherapists, but the frequency of such visits, for many reasons, is limited. So many studies, including those with the highest reliability, based on Cochrane reviews, shows a clearly higher efficacy of a training conducted under the supervision of a specialist with biofeedback than those performed independently by a patient. That's why we created PelviFly. Jointly, PelviFly and Kegel have created the world leader in the area of pelvic floor muscle training. Intuitive PelviFly software application and telecare portal with a chat, which facilitates the continuity of rehabilitation regardless of the place, ensuring a patient's involvement in the treatment process. The IT infrastructure allows to design individual training plans, observe the rehabilitation progress in real time, and keep in touch with patients. Advanced software technology, gamification, games addressing biomechanical goals, engaging programs, a training session in the form of a serious game. Patients are more involved in exercises when they can observe their progress. Data analysis, we developed a test of muscles based on urogynecological palpation scale. Kegel manometric vaginal probe, designed by engineers from Stanford University in the US. Currently, the device is used by more than 30,000 women in the world, and hundreds of specialists, including doctors and physiotherapists. We have 3 therapeutic vibration programs at various frequencies that are available on the telecare portal and activated by the therapist. At present, we cooperate with 100 specialists who use our solutions in their offices or by means telecare. Now we have 30,000 users and 100,000 trainings. Thank you for your attention. I will give the floor to Dr. Burkhard Abenstein.
Okay, hello everybody, and thank you very much, Ursula, for inviting me, and Gabriel. Big pleasure to be with you today during this webinar. I have to admit, it's the first webinar I'm taking part in, and I'm quite excited as well about this event. First of all, congratulations to both of you. It's overwhelming to take part in a webinar with more than 120 participants. Success already at the beginning. Well, I'm sitting here in Feldkirch, which is in the most western part of Austria, close to Switzerland. And I'm head of a department of obstetrics and gynecology in an academic teaching hospital. And urogynecology is one of my subspecialties. And I've been dealing with urogynecology for the last 25 years. And that exactly was the reason why I got into touch with Ursula and Gabriel. It was 2.5 years ago, approximately, in Krakow, when I participated in a meeting, international meeting on urogynecology. And there was an international floor and an industry setting with all the big companies. And there I met Ursula, and she was exactly as enthusiastic as during this morning opening session when she explained PelviFly to me. And I have to say that I have some experience with biofeedback tools for incontinence patients. Well, all of them were office-based models, meaning that patients had to go either to a doctor or to a hospital, to an outpatient department of a hospital. They had to travel. Then these tools were rather complicated and in the end also expensive. So they were not really suitable for the use of the patient at home. So this was my first impression when I saw PelviFly, when I saw the device, and I learned about the history behind it. It first of all is nicely engineered from the surface and from the engineering part. Secondly, by the app, it gets a very modern touch. I would even call it a little sexy, because in combination with a patient's smartphone, the patient can see what she's doing, how she's progressing, and she can even show it, her smartphone, with the app to a friend, and thereby overcome the shyness of the whole subject of incontinence, which is still a hidden problem in our societies. And then, after all, there is this potential of telemedicine, telecare, which allows to motivate the patient over a certain period of time and to closely watch the frequency of training and the progress of training by a professionist like a professional physiotherapist or nurse. I was excited at that moment in Krakow, and that's when we started a more professional relation and set up a pilot study, which we conduct now in Feldkirch, in my department, and also in my private office. We do a consultation. The patient has to see us at least once in the beginning. We do an exam. I will talk about that a little later. Together with a nurse, a specially trained nurse, or this can also be a physiotherapist. And by the time the patient knows what to do, we can dismiss her and give her to this telecare part of the study. So what are we doing with the patient? When the patient comes in, we find out, is the patient qualified for conservative treatment? We do a diagnostic workup, just as we did and as we always do with incontinent patients. Then either a midwife or nurse or physiotherapist, they assess for a functioning pelvic floor. They try to rule out disorders coming from another part of the body. They do a screening test together with the PelviFly device. At the end of this test, primary test, the patient gets a PDF report, and this is the basis for the pelvic coach to set up an individual training program for the patient. And then the pelvic coach accompanies the patient for a certain period of time. In our study, it's 3 months, and tries to keep the patient on track. Now, when we talk about inclusion criteria, we want to find out by this physical exam whether the patient is suitable for this type of training. We use standardized interviews for pelvic floor dysfunction, and we use standardized questionnaires which address not only urinary incontinence but also bowel incontinence or bladder emptying problems, as well as sexual function, as well as quality of life aspects. Then we do a routine gynecological exam of the patient where we look for anatomical defects. We look for the contractibility of the pelvic floor muscles, and we measure the degree of pelvic organ prolapse using the POP-Q quantification. And last but not least, it's important to find out whether the patient itself is qualified for conservative treatment. Important are two aspects. Language is the first. A patient has to be able to understand what we are telling, what we are trying to teach the patient. We also have patients coming from outside Austria which are not who are not speaking German properly. It's sometimes impossible to train them because of that aspect, and then it needs a certain amount of intellectuality. Let's say we sometimes have elderly patients with some degree of dementia, and also these patients we have to exclude, and I would advise to exclude. Then, according to the guidelines on urinary incontinence, we distinguish between the three different main types, I have to say, of urinary incontinence: stress, mixed, and urge. And for all of these patients, we do have two strategies, always starting with conservative treatment first as a rule, which consists of pelvic floor muscle training, lifestyle modification, and weight loss. Of course, we do have patients in Austria overweight, and it helps when they lose some weight, of course. Then we have the option of medical treatment, pharmacological treatment, especially for mixed and urge incontinence patients. And as a rule, a rough rule, I would say, if there's not an improvement after at least 3 months of training or conservative treatment, these patients will go into surgery. And the biggest part of these patients are patients with a huge prolapse, let's say 3rd or 4th degree of prolapse. I would like to add one little aspect. When we know that a patient will go into surgery, we try to get these patients familiar with the PelviFly concept. They can try it before surgery because they should use it after surgery to re-educate the pelvic floor. So we would even try to demonstrate this concept to them before they go into surgery. Well, once again, first-line treatment for incontinence is pelvic floor muscle training when the anatomy of the patient allows this type of training. And we do have really good and wide evidence that pelvic floor muscle training is effective, and it may prevent surgery for a certain amount of patients for a certain period of time. Probably not for the whole life, but for 5 to 10 years, surgery can probably be postponed by proper exercise. And when I say proper exercise, this is where PelviFly comes into place, because PelviFly allows the trainer, the teletrainer, to see how often a patient trains, and even more important, whether the patient trains properly or not, and motivate the patient to overcome some laziness firsthand, but then also to avoid improper training, because improper training is even worse than no training. And what we also can advise patients, we may advise them not only to contract, but also to relax. And this is especially important for patients with bladder emptying problems and patients with dyspareunia. So I can tell you that the pilot study we are conducting is progressing nicely. We only lost one patient so far. The others are motivated and they use it frequently, and we are very excited about the upcoming results of that study. So thank you so far for listening, and I'll be happy to take any questions afterwards.
So what we should prepare before to advise to use this device as gynecologists?
Well, we have to know the patient. We have to assess the patient with its personal anatomical problems. We have to decide the degree of prolapse. What we do know from the past is that patients with a third or fourth degree of prolapse is probably not the best patient for pelvic floor rehabilitation, because we do know that it needs at least a remaining function of the connective tissue. And we know that in third or fourth degree prolapse, the connective tissue is too disrupted in order to enable muscle rehabilitation. So we have to exclude this first. But then it's just a normal exam like any gynecologist can do. It needs a chair for a gynae exam, and it needs a simple ultrasound machine to assess the patient properly.
Burkhard, maybe this question, what grade of prolapse makes sense to work with the system? What do you think?
In my experience until now, up to second degree of prolapse, there are patients with a third degree prolapse who want to try it. I would not object, and I would support them. But in my experience, the third and fourth degree prolapse are not very suitable for pelvic floor rehabilitation. after surgery, because these patients usually then go to surgery. After surgery, for them it's good to know what they will expect, so we can show the system to them before surgery, because they will have to use it afterwards. There was a question, is it safe? It's absolutely safe.
I think that we'll go to the next part of the presentation now. If there are any questions, you can always send us an email using contact@pelvifly.com, and we will share the questions with Dr. Burkhardt. And thank you for participating now. We'll now move to the next part and just present the device and the mobile application quickly. Thank you.
Thank you.
My name is Gabriel Herman. I'm responsible for the IT side of the project, and I will try to present you as fast as it is possible what does the application looks like and training portal. So what is important, we have a device which is an intravaginal probe that is very sensitive, and it is a pressure sensor, and it connects with Bluetooth with mobile application. So when we go to the mobile application, it's a very easy tool for the user. You can muscles, or you should do a warm-up or a training for control, endurance, or strength. So different parts, different parameters can be trained, and we can focus on. We have algorithms inside the telecare system. This is a kind of a progress track. So you see 3 phases of training: cognitive, control, and improvement phase. We all know that you need to repeat 100,000 times the exercises to have a result and to allow your muscles to react automatically when they are needed. So it's 2%. After 1-2 days, you are at the level of 2%, and then you move to 100%. 3 phases and 36 tasks. We'll ask the questions from the chat maybe at the end of this part of the presentation. Immediately after the training, like warm up or other, you see the results in the mobile application. So the device is working like a biofeedback. So you see in a real time the results of your muscles activity at the smartphone screen, on the smartphone screen. But at the same time, they are transferred to the training portal. So pelvic coach, specialists, physiotherapists, gynecologists can see the results, can evaluate them, can do some modifications to the training program. Games are based on the biomechanical assumptions. So they look funny, like birds flying, like basketball, or flowers. You can imagine, because it should be engaging. Women spend a lot of time doing these exercises, so we need to focus on the graphic view. But behind that is the knowledge. For example, if we do a test of muscles, we know exactly what is the maximum voluntary contraction. So if we know the maximum voluntary contraction, we can then set up a level for a particular workout. For example, here, the level at which are the flowers is, for example, 20% of maximum voluntary contraction. In the next part, we'll say more that in many cases, when you use a device without any support, you can do mistakes because you can activate your muscles wrongly. You can use too much power. We spent a lot of time with physiotherapists to design the system in a way that it is safe for users. So we know what is your strength of muscles, and we then prepare all the trainings according to your power, according to your individual parameters. So there is a question, can the programs be customized? The answer is yes. And if you have an access to the training portal as a specialist, you can design your own training plans. So you can prepare a different plan for different cases and different intensity of the program. I will now move to the training portal. So from perspective of the user, you see butterflies, you see some goals to achieve. There was a question: how long is the workout? It's around women should spend around 5 minutes, 8 minutes per day, 4 times a week. So it's no more than, it's a selective training, so it's enough to just spend a few minutes, but it should be done regularly, 4 or 5 times a week. This is and at least 6 to 9 months to have really good results, because such time is needed to learn the muscles to react automatically. So that's why we always say it's a kind of a hybrid therapy, kind of a mixed therapy, that you combine office consultations with remote training. We will not take care of a patient on a distance fully, because we need to see the patients, we need to consult, we need to include to the program, as it was stated by Dr. Burkhardt. Then we need physiotherapists that will check the other disorders, that will do some manual therapy, that will learn the patient to do the first training properly, to do the lift and squeeze. And then we can take care of the person that can do an intensive program under the supervision at home. So this is the perspective of the user. Now let's move to the training portal. It's a place dedicated for practitioners, for clinicians. You have your own account. You see your own patients, and see this is a demo account, so you see like anonymous users, but you see the last training, the last test, the registration date. So you exactly can follow and check the compliance. This is a very important thing, because you always ask practitioners, as clinicians, ask patients to do homework, but you cannot check it. You don't have the really good ability to control the training adherence. You can go deeper into details. You can check every training. You can see the results. You can see graphs. You can see test of muscles. What is very important in the system, and it was asked in questions, it is that we can create an individual training program. So we have a calendar like this. Here is there are exercises for 23rd, 24th April. You can see every day you have a training plan. And if it is done, it's green. And if it is not done, it is red. So you see exactly that you missed some trainings. And depending on the goal of the training, for example, if you want to improve your bladder control, or you want to improve sexual life, like to have some recovery, for example, after childbirth or after delivery, or you are before the menopausal period, depending on that, you can create different training program. And then after every exercises, you see the results. And it can be a graph that you see what was the traction of the training. And you see also statistical data. There are some specialists that want to go deeper into details. So there is a standard deviation, average, and all other stuff that you can use to go deeper into details. What is important, what you can customize as this is a test of muscles. Yes, let's stay here for a while, because one of the most important thing that we were focused in PelviFly was a test of muscles. We wanted to do the very popular around the world test that is based on Oxford and Perfect Scale, and to do it with a tool that can be more objective. Because if you use a palpation method, it can be different a little bit for different users, for different gynecologists or physiotherapists. Also, there is a there can be some problem that women can feel stressed during the visit. So if you ask someone to do the squeeze and use palpation method, you can have not a very good result at the moment. So our idea was to let women to do the test of muscles based on Oxford scale at home and see the results then in a training portal. So you see here that we can ask someone to do gentle squeezes. We can ask to do maximum voluntary contractions. So, and then it's like 3 different samples. Then we can do an average. So we know exactly what is the result. We then check endurance. So we ask user to squeeze muscle and to keep it for 20 seconds. And we ask to do it at the level of 20% of maximum voluntary contraction and 100%. We know those numbers exactly because we have it in step 2, in step 3. So then we can ask to do 20%, 100% and check what is the endurance, what is, how does it look like. There's a question of, it's always that you can share the result with pelvic coach. So you can do, there are different modes in the mobile application. You can train on your own, but you can also pick up, select a pelvic coach. This is why we organize this international webinar also, because we would like to invite specialists from different countries to join us and to become like pelvic coaches. So that that women that buy device in different places can go to the specialist, can be diagnosed, can do the first exercise, and then can do the exercises remotely. We will never try to sell the device as a standalone device. Even if we do some promotion on a website, every single user is assigned to a pelvic coach from PelviFly and is asked some basic questions, because we want to be sure that the device is used carefully. And if you really want to solve any medical problem, any medical issue, you should always follow the appropriate path. So first you should go to the gynecologist, then you should visit physiotherapist office, and then you can combine consultations, office consultations with remote telecare. Now during the pandemic, it's like more useful to have this device, to have this tool, but always it's good to combine those two. So let's finish this test. It's like in the 5th step, we ask to do very fast contractions. So squeeze, relax, and it is the goal is 100% of maximum voluntary contraction. So we see if there is an immediate reaction to the signal from the brain, and we see if there is a full relaxation after each squeeze. So the test of muscles is very important, because based on these results, we can prepare training program, we can evaluate progress, track progress. It is also very popular that it is used by physiotherapists or gynecologists as something special to palpation method. So you can do a palpation method, you can check Oxford scale, the strength of muscles, but you can also use the device, do the test of muscles, and share with the user PDF report. So you should not treat it as a full medical diagnosis, but it can help you to monitor, to have some objective scale that you can then compare. You can check the results from time to time. So even it's working like this. We do not recommend to use the device by man. This is the device, the intravaginal probe. This one goes inside during the training, and this outside. This is a battery and Bluetooth monitoring, so it goes outside. We can deflate it, make it a little bit smaller, like this. The most important thing, the two biggest differences between this device and other available on the market is that it's the only pressure sensor. So we have like a very good, we can see if the patient is, for example, relaxing or the muscles are stretch at the beginning. In many cases, there is a problem that there is a lot of stress during the daily life, and women are stressed. So during the exercises, we can see that someone is relaxing, is going like below zero. If you have a mechanical sensor, like you can only press and relax, you see like from 0 to some power that is used. When you have a pressure sensor, you can deflate it, you can like relax and see better results. So it's very good tool. And second is vibrations. At the beginning, it can work like a biofeedback. So if you squeeze, you feel vibrations. But from the therapeutical point of view, it's great, and it's like explored by Ursula and other scientists. It's like you have a very gentle squeeze. Sometimes you can use like electrostimulation, but you can always enable vibrations at the end of the gentle squeeze, so it will activate your muscles more, your receptors, and they can react and squeeze stronger. So we use vibrations from sometimes to help to relax, sometimes as a biofeedback, and sometimes we use it as to boost the squeeze. So this is for example, if you see the presentation, you can see how to configure the training. We can recommend 3 different positions, like standing position, laying position, and knee elbow position. So you see that you can design a training plan for a particular user. If you have entry level, some beginner, you will always recommend like lying position. But if you have some problems with organ prolapse or after childbirth, if there are some identified problems, you can use elbow knee position. And after some time, we go to the standing position, because training should be much more functional than at the beginning. There's a question: how can I try this device? We answered it at the end of the presentation. It's available now in English, in German, in Italian, in Russian, and in Polish. I think that in 1 month time, it will be in Spanish also. Does the physiotherapist perform vaginal examination during the initial assessment? Is that we can do the assessment using the device. That's why, for example, we have a very good results, because always if you do the test of muscles at home, you can do some mistakes. If you do it at the physiotherapist's office under the control, you can control the breathing, you can control stomach muscles and other things that you can, and then we are 100% sure that we have a very good parameters to conduct training. Is there a smaller head of the device? No, the device is like one size. There are always questions if the device is like too small or too big. It's an average size, and we believe it should be rather bigger than smaller, because in many cases we see that it is like if you do squeeze, you can lose the device, like it can go out and will not work properly. It should really go and sit inside properly to do a really good like traction of the activation. I think that we'll do different sizes in the future, because it should be more adjustable. You can always like deflate or inflate, so it will be a little bigger or smaller in the future. Let's back to the configuration of the training. Is that first thing is that you can recommend a standing, laying, or elbow knee position, and it will immediately be presented in mobile application. So the user will see that today I need to do an exercise in a standing position and tomorrow in laying position. Second thing, you create a training program. So you have speed, strength, warm up, you have like breaks, and you can create your own training plan. But we also have like ready training programs for a young mom, first month, second month, 3 months program. So you don't have to prepare it like step by step, but you can also go deep into details and do it on your own. You can also decide whether to enable or disable vibrations, use 20%, 50%, or a stable vibration. So it's always designed by the pelvic coach. You are the owner of the therapy, you own the relation with the patient. So we are not like a medical procedure. You always are responsible to use the tools properly and to help the patients. If you feel more comfortable to ask for a regular visit, you then ask for visits. If you want to ask someone to focus more on training at home, you then ask to do exercises at home, but you have a full access to the data. You have also very good communication, direct communication, because between you as pelvic coach and user, there is a chat inside the application, so you can use it to ask questions and to be in a strict contact. We'll now move to the last part from the scientific point of view. I would say it's barriers limiting the effectiveness of exercises. There are like 3 challenges that we want to address using this device, but we also be like we should be more aware that it is important. One is incorrect performance of exercises. Second is decreasing training compliance, and third is insufficient motivation. Why it is important and how to mitigate this? Incorrect performance of exercises. This is why in many cases, maybe not at the beginning, but after some time or at the beginning, every single user should visit physiotherapist's office or trained personnel, that we should be 100% sure that the activation of muscles, that the activation pattern is appropriate. So this is important. We also, of course, have a lot of like instructions, guidelines, and we can also have some alerts that, for example, if you use abdominals or other muscles, I see the question is now, if we see that it is not used properly, like there is like not lift or there is a push, we see a different results. And there are some alerts, and we see it on the graph that the exercises are not done appropriately, and we can instruct how to do it better. But at this stage of the project, we should be focused that always we should have this initial visit. As it was said at the beginning by Dr. Burkhardt, the problem of urinary continence is very huge, and it's a social like disease. Many cases are not like diagnosed, so the patients are still somewhere out there. So we like break the barriers, we engage to buy the device, but immediately after that, we ask them to go to pelvic coaches. That's why we need to have partners in different parts of the world, Europe, because we should work together. Incorrect performance of exercises. What we also see is that when you use a lot of available on the market tools, you can use not appropriate strength of muscles. Like you can do too much squeeze, you cannot, sometimes you do not relax. So it is always in PelviFly that we focus on that, and we spend a lot of time to create programs that really reflects your individual parameters. So it's very important, and in every cases when you use, for example, too much power, you can have an alert, and then you can contact the person. Next one is, this is also very important that I said about it, that algorithm selects, and the contraction is based on the strength from the test of muscles. But the second thing is that the whole concept of PelviFly, in order to improve bladder weakness and to support pelvic floor muscles to react and to protect against urinary incontinence, is to work at low intensity. It's like we try to prepare women to run marathon, not to run sprint. We don't need very strong muscles, but we need them with a good endurance, stamina. So it's like maximum is 20% of maximum voluntary contractions. a lot of relaxation, and with this low intensity program, you work the most important part of the program. The second thing, what is decreasing training compliance, and the next is motivation. I would say it's the biggest challenge for all of us in this combined therapy, in this holistic approach, because in many cases it's not a big thing to go for 5 visits or 6 visits to the office. It's not a big challenge to play a game like 2 weeks, 1 month, but to spend 6 months or 9 months in the training regime, you need to have a motivation, and in many cases it will be an external motivation, not only internal. So the role of pelvic coach is crucial. Even if we in a normal life, like we try to prepare for half marathon or marathon, we very often pick up a coach because it's much easier if someone calls you in the morning and asks to do 10 kilometers today. It's very difficult even to do it with games, gamification points, and badges. It's much better if you have a person that really takes care of you and want to help you to go to the end of the therapy. So it's all about the role at the beginning to prepare for the training, to do it properly, but then to educate, to change daily habits, to lose weight, to do everything that can help your pelvic floor muscles, but also to do the exercises regularly. In Ursula PhD, she did a research and checked what is the difference if you have supervision in the training or not. It's a part of the PhD, and the difference was significant. Of course, it's almost obvious that with a pelvic coach you will have better results, but it is also it has also scientific approval. You can see more data about the cases and some studies at the website pelviccoach.com or PelviFly. We see that even when we have users that tell us from that point of time, I want to do exercises on my own, I don't want your assistance, then we see that it's like few days, 1 week, and then we need to motivate the person again. It's all that we did also a lot of surveys, and when we ask women what they are looking for, it's home training and external motivation and specialist supervision. So that is all what is inside the PelviFly project. You can do exercises at home, because if you have a young child, young baby, you are a young mom, especially today when you cannot travel easily, you want to do exercises at home, but it should be supervised, it should be under control. So you need to have a device to check some state. You can, of course, do a mix. You can do exercises without a device, but also with a device. You can use the device as a test only from time to time, but it's good to have a connection and traction of the results. You need to have external motivation. This is what I said about the role of coach, and specialist supervision, because those coaches are most medical people with medical background, like physiotherapists, nurses. So we can be sure that you share the knowledge that is based on the medical assumptions. Both PelviFly, the device, mobile application, and training portal can be used in your office. You can do test of muscles, and for different patients, you can help them to start during the normal, regular consultation. But it's also a huge benefit for women that see the muscles activity, that has biofeedback, and have a chance to see the progress and to do the exercises at home. How to join the project? This is a kind of a chance that we ask, and we have partners in the UK, we have partners in Italy, we have partners in the USA, But in every country, and it should be like also regional, we should have a partner that can combine and use the device in the office, but also that we can recommend to go for a visit for women that will buy directly from us. So it should be like a very close cooperation. Today you can like order what we propose, how to start with the project. It's important that you should feel comfortable to test the system before you pay any significant amounts of money. It should be very helpful and useful for specialists, especially during the pandemic now. So it's very important to have this opportunity to provide this service to patients now. So we try to keep the prices low for users and for specialists as it is possible. So you start with a device. I will present you the web pages in a minute where you can use it. There is a discount code, so the device is €165, but you will not only get the device. As a specialist, we will ask you simple questions. Where do you work, or you are a physiotherapist or gynecologist, or you represent some medical clinic? If you buy the device, we'll give you a special assistance, we'll do the evaluation test of muscles. We'll try to present you the demo of the training portal. We will let you to both check the device from the perspective of the user, but also a little bit from the perspective of pelvic coach. If you decide then after this buying the device that you want to go deeper into details and you want to become our partner, we can do a fully online training like it is done now using a webinar or some online connection. And it will be €149 per seminar. It's on average 2 hours to understand the basics of the system, how to use the training platform, and how to design the program for patients. So it can be done, the decision whether to go with the online training and implement the service in your office, you can take a decision later. And then there is a very little price, like starting from €15 per month. So you can have a monthly access to the portal. Of course, you need to have devices. So we also have a kind of discounted devices for patients. So you can buy them on behalf of patients, or you can ask them to buy directly from PelviFly or other distributors. So it's like start with the device and check it where, if you are, it doesn't matter in what part of the world you are. Then you can decide to learn how to use the system. We can do this training, I think, in English, of course, in Italian without any problem. In other languages, it will be much more difficult. We prefer to do it in English. Where you can order it, you can use pelvifly.com. So it's our main page, pelvifly.com. But then go to the English version, of course. And if you use the discount code, it will be available today and tomorrow. You will get a 15% discount. Having a device, you then connect with PelviFly mobile application, and you can test it as a user. And we will also contact you and to explain you more how to become pelvic coach and how to use the system properly. If you are in the UK or Ireland, please use the site Pioneer Medical Europe. I will try to share, maybe we'll also do a kind of a summary after this webinar. So we will have these website addresses on your inbox. The same discount code on this website, Pioneer Medical Europe. You will have minus 50%. You can pay in British pounds, and it will be delivered directly from the UK. We have also a partner in Italy. So you just put pelvifly.it and you can order directly from it. I will now answer the questions. There was a question if we recognize the difference, what kind of muscles you use. Of course, it is not so easy to distinguish whether you use exactly pelvic floor muscles or other muscles. In many cases, we see that there are some alerts, and we see it on charts, but this is the biggest challenge. This is the moment that we need to do the initial test of muscles at least one visit at the beginning in the physiotherapist office. So it should be done under your supervision, that we are 100% sure that the user knows exactly how to do the squeeze. Also, I think it is important if you want to learn more and ask questions to us, you can use this email contact at pelvifly.com. I will put it also in chat. So we will answer all the questions as soon as it is possible. But we strongly invite you to start with the device and then to go deeper into details. If we have some problems with pain, and it always depends on the also size of the device, and we recommend in many cases, if you have a medical problem, it is very important to immediately it is your decision to include to the program or not to include. Will not take any decisions, medical decisions as PelviFly. What's the price for patients? It's in Europe it is 199 euro, and in different countries it's more or less the same. So it's 199 euro for a patient, but it is also very important to know that you as a specialist can have access to these devices with some discount. So you can resell them with a discounted price. There are also special programs that, for example, if you want to convert your base of patients due to the coronavirus, we can do if you want more devices, we can really do a significant discount. If you want to start with a big group of patients, we support it strongly, and we'll also help you at the beginning to become pelvic coach, because it is important to learn how to use this telecare system. So we do double coverage. We try to do the same job as you and to help you to understand all the issues. Is there any research conducted on a larger scale? There was a research with the PhD of Ursula. There are cases on our websites. Also, Dr. Burkhardt is with us because he started a pilot of preclinical trials, and our idea is to start with a bigger group to check more details if we can compare what results we can achieve in a longer term with the therapy. So it is under the go. We also start a pilot in Chile. It will be available in Spanish language. So we are also open to cooperate in scientific cooperation, to cooperate with a research in different parts of the world. We have already flyers. We have some information. So this is all we can share with you when you contact with us on contact@pelvifly.com. You can see us on Facebook, on our website. We are fully focused to educate women, to help to address this issue, to also to prepare, to share a lot of knowledge. There is something that is called a virtual assistant. It is also inside the mobile application. There is a huge database of knowledge how you can take care of yourself. So we are also very open to educate and to help women. What is your experience with women that have delivered with traumatic pelvic birth? Sorry, some errors. Of course, it depends on the individual parameters. It's hard to say at this stage, but in some cases we are helpful. It is always the decision of a doctor, gynecologist, whether to include to the program or not. I think that we'll end the webinar now because it's almost 1 hour, so we should keep to the agenda. We should be in compliance with that. Thank you, Dr. Burkhardt, for participation. We'll, of course, if there are more questions, we'll pass them to you.
Thank you, Gabriel. Thank you, Ursula. Thank you all participants, and have a nice day.
Yes. Thank you all, and be in touch by email or directly. Thank you very much. Bye.
Bye.